So last day we just completed 12 observations and second prescription. What I was telling is that if you get questions from my exam, those will always be from your HR Roberts. So reading only success, only the points which are covered from the MISM in success, it is not enough. It is better to have a thorough knowledge of MISM. So when we will be dealing with chronic disease MISMs, we will go over that. Apart from that, there are certain topics in philosophy part which are equally important. We will be first studying those today. After that, I will go to chronic disease. Fine. And further after that, I'll be discussing the points which are important from your Robert's miasms, those things. Essentials of successful prescribing. Can anyone tell me this is related to which author's philosophy? Kent or Stuart Close or Roberts? Which particular author's philosophy? Yes, anyone? It will be one among the three. So which one is it? No one. Okay. Essentials of successful prescribing. This is a chapter from your Kent's philosophy. Okay. Whatever we will be discussing in this particular topic, it will be all Dr. Kent's guidance. There are some very important points. That is why this chapter is important. Okay. The first thing that he has said is that whenever we are doing prescription of homeopathic remedy, it is a matter of growth and progress. Prescription of homeopathic remedy is a matter of growth and progress. So it can be said that best of the wine is saved for the last. Best of the wine is saved for the last. That is what he said regarding prescription. Okay. Now, another notion that he had is that single potency is not sufficient for chronic disease. For that, we need series in degrees. This you will get as MCQ question. Who said about this series in degrees? So series in degrees, this was given by Dr. J.T. Kent because he said that in case of chronic disease, only a single potency is not sufficient. We need a series of degrees. In chronic disease, single potency is not sufficient. Okay. This is an important MCQ pointer. Another thing, he has compared vital force. You know the octaves of musical tones. What were the do, re, mi, fa, sol, la, ti, do this? There are octaves now. So he has compared those with octaves in simple substance. This also comes as MCQ question. octaves in simple substance through which we can correspond the various planes of the interior organism. Okay. Now, Hahnemann, in respect to this prescription, he has again quoted a particular saying by Hahnemann in chronic disease. This I have seen, these quotes. Why I am discussing all these quotes? Because these quotes you will find then and there in various papers. The last UPSC, there were a lot of them. Who said which one? Okay. So that is why these things are important. If you read the Kent thoroughly, maximum are from Kent only. So if you read the Kent thoroughly, chances are that you might get it common. Hahnemann has told in chronic disease that medicinal virtues of drugs might be developed why this is important in this context I will tell you might be developed in an infinite series of degrees. Sorry, by means of triturating and shaking of the raw material. Now see, here Hahnemann has already mentioned about series of degrees. From here only he has got this series of degrees, the idea of series of degrees in case of potencies. Fine. So if you get this particular quote, it is given by Hahnemann, but who like brought out series of in degrees? That is Kent. Acha, by the way, what is a series in degrees? Can anyone explain me? When I say in case of potencies, Kent told to use series in degrees. What is that particular thing?
30 potential, then 200, then 1. Ma'am.
And it goes on like that. Okay. So basically, the idea came from Hahnemann's this particular quote in chronic disease. Okay. Now there are some points which are to be noted regarding the selection of potency. First and foremost is that we should keep in individual.
Please take that.
We should keep in mind the individual. Yes, someone was telling something, yes?
My voice is breaking.
Okay. Huh? What is it?
No, no.
मैम वॉइस ब्रेक हो रही है आपकी.
Okay. I'll just repeat it. I was telling that there are certain points which you should keep in mind when you are about to select a particular potency. First thing is that you should keep in mind of the individual. Next is the constitution. Individual means the constitution of the individual makes a difference. So the constitution is important. And according to Hahnemann, 30C is a potency low enough to begin with. So you can begin your prescription with 30C, as low as 30C. Okay. These things, though you know still. Next is that you know that nature of disease. Nature of disease is another important factor for determining the potencies. Those who are having organic disease. Acha, 30C is the potency to begin with. Note this. In case of organic disease, use low potencies under 30 or 200. So when there are structural changes, you will use under 30C or 200C, not very high potencies. Another point is that you should begin with a low potency and then go higher and higher. Begin with low potency and go higher. When you are noting the nature of disease, you should also note the nature of medicines. Either if it is a deep acting or a short acting one. Okay. In acute disease, note this point, in acute disease, 1M and 10M are most useful. This is said by Kent. Very important point. So this is an important point, new point. In acute disease, these things may come as MCQ question. What happens is we feel that it is very easy, but it is not. Actually, it is just taken from the book itself. Okay. In acute disease, 1M and 10M are most useful. 1M and 10M. So if there are options, choose for these two. Not 200, not CM, not DM. Okay. 10M to MM. Okay. After 10M, 10M to MM, these potencies can be used in ordinary chronic disease, but not in case of sensitive persons. These can be used in ordinary chronic disease. You can give them in chronic disease. But you should keep in mind that the persons should not be sensitive, not sensitive individuals. What will happen if we give to sensitive individuals?
Acute exacerbation.
They can, what will they do? They will prove everything. Okay. Sort of idiosyncrasy. So they will bring out the symptoms. So it will not work. Okay. Acha, write these things down. Then we will go to the next part. Few more points are there. Just tell me after you have done writing this slide. Hope you have written this. Okay. Now, these were all regarding to the selection of the potency. Now, how will you administer a particular potency? Acha, now tell me which one is better. You should give your medicines dry or you should give them in water. Which one is better? Which will act better?
Water.
Why?
Because it cover more surface than the dry.
Or some more sentient nerves, as per your knowledge in organon. Okay. But if you go through Kant's philosophy, you will see that Kant has told it does not matter whether the remedy is given in water or not. Effect will be the same. Okay. So administration is done in whichever way, the result will be same. If it is given in water or your spoonful doses like Saclac, or if you give in globules, whatever it is, pellets, dry on tongue, whatever it is. So the result of the medicine will be the same. Okay. Next point regarding administration. When medicines are given at interval, the curative power is increased. If you repeat very frequently, it will not act very beneficially. Okay. So when medicines are given at interval, the curative power is increased. Okay. Just give me a minute. Sorry, there was a issue with my printer. Have you written those 2 points which I had already discussed, or I will write it once more?
हो गया.
हो गया ना? Okay. So what I was telling is that if medicines are given at proper intervals, their curative power is increased. Okay. But this Hahnemann has already told that if any positive effect or if any improvement has already been observed, then the medicine should always be discontinued. So if positive effect has been obtained, then medicine should be discontinued. Next one, very, very important point. Third point. In chronic disease, in case of chronic disease, the first prescription, when it is made dry on the tongue, single dose dry on the tongue, it will be the best. So in case of chronic disease, best is best for a first prescription. First prescription, the single dose dry on the tongue. Dry on tongue, this is the best. Okay. Severe acute sickness, what we will do? Single dose or not? In case of severe acute disease, what you will do?
रिपीट करना पड़ता है अगर ज्यादा हो मतलब ये रहता है तो
Very good.
acute
Several
dose में।
doses in quick succession. Very good. Several doses in quick succession. Okay. In case of chronic disease, after you have given this single dose, after single doses have been given, provided the interval is long, then you will have to give a series of doses. Okay. So single dose, first you give single dose. You do not repeat anything until there are long intervals. And then when it has well acted, after it has well acted, then you give series of doses. Series of doses. It will act deeper, stronger. It will have a stronger and deeper action. Stronger and deeper action. Fine. Okay. Another one in case of chronic disease, point number 6. In a case of 30C and 200C potencies, it is very necessary to give these two potencies in water than when using high potency. So whenever in case of chronic disease, when you are giving 30C or 200C, it is very important, it is very beneficial to give these two potencies in water. These should be administered in water. You do not need to give 1M, 10M, 50M in water. But it is necessary or it is important to give 30C and 200C in water in case of chronic disease. Fine. Next one is, if you give very high potency. हाँ बोलो.
मैम सीरीज ऑफ डोज में ये क्या मतलब नॉर्मल जो क्रॉनिक डिजीज के बाद सिंगल डोज के बाद उसका हायर डोज देना चाहिए ये बोला जाता है क्या सीरीज ऑफ डोज के बारे में?
Series of doses, not potency. How many?
ओ ठीक है मतलब वही एक ही पोटेंसी को रिपीट करना है.
It depends on the patient. Then again.
अच्छा.
Not the single one. It is not necessary that you will give go on giving 200 one after the another. It is not like that. Next one. I was asking, you just answered few minutes back that if we give high potencies to very sensitive individuals, we will have an acute exacerbation. I told that they can prove medicines. Another point that can happen to this when we give very high potencies to sensitive persons, feeble persons, is that we can bring their old complaints. Their old complaints can come back. So when very high potency is given to sensitive individuals, what happens? Old complaints and symptoms, they come back very hurriedly, very violently. Okay. Old complaints return violently and hurriedly. Achha, suppose a patient comes to you. Now, the patient has severe dysmenorrhea. Fine. The patient is tormented with her dysmenorrhea and comes to you. You give a medicine. What will be the best time to give the medicine? During menstruation, before menstruation, after menstruation?
After menstruation.
After
Before
menstruation.
menstruation.
No, not before, not before. Whenever you are giving any medicine for the chronic disease, you should wait till the paroxysm or till the what to say, that excitemental phase has gone. When the patient is in completely calm. Like if you are giving medicine for migraine, you should not administer it when the patient is having that attack of migraine. If you are giving medicine for epilepsy, not during that attack. After that has subsided, it is same like intermittent fever, not during the paroxysm. After sweat comes. So it is same for each and every complaint. Whenever you are giving the acute phase, it should be over. Then only you can proceed to give the chronic medicine. Okay. So it will never a deep acting. Write this down. This is very very important. A deep acting chronic remedy a deep acting chronic remedy should seldom be given in middle of exacerbation. Achha, in case of dysmenorrhea, what is the ideal time? I told you after menses, but how many days? 2 days after menses, 10 days. What is the ideal time when you can give?
Second day.
Never. 4 days after menses has set in. Whenever you are, note this, huh? Whenever you are, those who are doing clinic and all, you are administering some potency and this and that. Macphos is not, Macphos is, suppose you are giving for dysmenorrhea, it is not the chronic one. But whenever suppose you are, the patient is of natramute, you are giving natramute 200 or 0/1, 0/2, whatever it is. You tell the patient to stop the medicine for 4 days and again to continue after the fourth day. Hahnemann has said this very clearly that any chronic medicine, when you are giving for chronic disease, it should be stopped for 4 days, 96 hours after menses are set in. After that only you can give again your medicine. Fine. 96 hours. It makes it 4 days. So after 4 days only the patient can be again to take your medicine. Fine. Acha. Any question from this part? Then we will go to the Roberts.
Ma'am, 7 point, please repeat.
I told that whenever you are giving very high potency to a sensitive individual, their old complaints. Suppose the patient is suffering from, say, skin disease, but the patient, skin disease is ringworm, but the patient had scabies when he was a child. Sensitive individual, whenever you give very high potency, that scabies will return very violently and very rapidly. You will not be able to control it. That is it. Okay. Clear? Yes or no?
Yes, ma'am.
Ma'am, any kind of ma'am, the time period of 96 hours, any kind of disease or just only dysmenorrhea?
No, in case of menses, when you are giving to any female, any chronic
The only
remedy,
four
when you
days
are
because of the
administering
mens. Okay, ma'am.
during menses, you cannot give medicine. Whether it is now, I understood your question. You are asking me that if, ma'am, the patient comes with suppose migraine,
Yes, ma'am, I
right?
guess.
Now, will I stop the medicine during menses, because migraine technically has no relation with dysmenorrhea, right? Dysmenorrhea or
Yes,
menstruation, whatever. So will
yes,
I
ma'am.
stop it, or will the patient continue? If it
Yes,
is a chronic, if you are giving in potency based on the totality, obviously you will stop it for the 4 days. You are giving medicine due to whatever reason, whatever disease you are treating, you will stop the medicine for 4 days during menses. Then only the patient can. Not only in case of menstrual problems, in case of any complaint.
Ma'am, 4 days before menses and after 4 days menses.
Before menses, we will be dealing with the aphorisms. Then again, we will come to this topic. Okay. This is a very important question. When should this, in case of females, when should the medicine given after menses has set in? This is a very important question. So do not get confused. It is after 4 days after menses. Fine. Achha, any more queries? Any more confusions?
Ma'am, after 4 days after the menses have completed, or when the menses
No,
have
no, no, no,
started?
no. Day one is your the when the person is bleeding. Day one. After day four, from day five, you can give.
If the menses are still
After
continuing, we can administer.
if the menses are still continuing, 4 days after menses have set in, after menses have started.
Okay,
Got
ma'am.
it?
Yes.
Oh, anyone else? Any problem? Any queries? And everything? I'll take that as a yes. I will go to the next slide. Yeah. From Robert's, few points are important, as I told. First is related to homeopathy. Just write this line. Acha, who gave the law of least action? Who gave it? Law of least action. Never heard of it. So uncommon. Law of least action formulated by very important MCQ point. This is actually given by a French mathematician. Name of that mathematician is anyone? Maupertuis. Acha, spelling, I think my handwriting is not legible. Maupertius. Maupertuis. So I will write it here in capital. Maupertuis. So law of least action was formulated by him. What does that say? That quantity of action quantity of action necessary to effect any change in nature is the least possible. Now, can you tell me, any one of you, that what is exactly the meaning in relation to homeopathy? Why am I taken something which has been said by some French mathematician and I'm teaching you today in organon class? Why it is relevant in our homeopathic literature?
Because of homeopathy, which least action, yeah, least action relate to the in homeopathy on of minimum dose.
Yes, very good. Okay. Another
which least action least action relate to the in homeopathy on of minimum dose.
Yes, very good. Okay. Another related to this thing, another quote you will get, which was said by Finke. Finke, I hope if you have, acha, pharmacy classes started na, so Finke should have been discussed. So he has told that the decisive amount is always minimal and infinitesimal. And infinitesimal. These two both are very important MCQ questions. This particular quotation and law of least action was formulated by whom? Both of these are very important and very common MCQ questions. Finke has said that the decisive amount is always minimal and infinitesimal. Now you tell me, I have a question for you. Will the quantity of the medicine determine the quality of the action? Yes or no? Is there any relation
अगर
or is there not? No,
अगर
one word,
मिनिमम
one
डोज
word.
के नीचे
No. I don't want explanation. MCQ question, just once, yes or no. Will the quality of the action of that homeopathic medicine, is it is it directed by the quantity? Will it depend? Yes or no? Depend करता है कि नहीं?
No. No.
No. Anyone else?
No.
Everyone is telling no. But I will say yes, it depends. It depends in inverse ratio. That is what Roberts has said.
Okay.
If I say yes, it will sound very weird. But next point is it is in inverse ratio. The lesser the quantity, better the quality.
Depend on.
Quality of the action of. Acha, please mute your mic, Saroj.
Yes.
Is determined by its quantity. In inverse ratio. Okay. Now, auxiliary symptom, just one word thing. What is it? What kind of symptom? PSC or AIMS exam, I don't know, I forgot, but it came somewhere. That is why I have put it. What is it? What kind of symptom is an auxiliary symptom? Bolo. You can guess. I won't deduct any marks if you guess. Rather, I'm happy. If you interact, I will be very happy.
accessory symptoms are same as auxiliary symptoms maybe.
Uh-huh.
Accessory symptoms of chief complaint may be same with auxiliary symptoms.
Accessory symptoms are different. Auxiliary symptoms, concomitant symptoms, another name of concomitant symptoms is auxiliary symptom. So what is concomitant? I have told you.
That is that have symptoms that have no physiological relation with the chief complaint.
Pathological relation from the that thing that was only asked. Auxiliary symptom, what kind of symptom is it? There were 4 options. Among them, you have to pick up the concomitant. Okay. Next, what is susceptibility?
Individual capacity to react and stimuli.
It's a reaction of organism to external and internal influences. Good. Okay. Why I have taken up this? This is a very easy thing you all know, because Roberts has compared susceptibility to vacuum. That is important in susceptibility part from Roberts' philosophy. Who has compared this? This comes directly like this. Who has compared susceptibility to vacuum? That is the question. Just write down the line. In
मैम
analyzing
आवाज चला
susceptibility.
जा रहा है.
Acha, I will repeat. No problem. In analyzing susceptibility, we find it very largely an expression of a vacuum in the individual. Okay. So this expression of vacuum, this Roberts has compared susceptibility to vacuum. This part is important. This is us. So write it and tell me after you have written this down. Written, can we go? Done. Hmm?
मैम आवाज नहीं आ रहा.
कौन सा क्या मिस हुआ है बोलो? I will repeat. Did you miss
मेरे को
anything?
लगा नो मैम अभी
Huh?
आवाज आ रहा था तो मेरे को लगा आप कुछ बोल रहे हैं.
नहीं. I was giving you time to write down. After you have written this, please tell me. Then we will go to the next slide.
हो गया.
Okay. Good. Taking the case. Why this one is important? Because Roberts has given 4 points while case taking. First and foremost of this is avoid all leading questions. What are leading questions?
Leading question like yes no, if the patient give yes no answer,
Huh.
that type of question.
Because some patients are very anxious when they come to the doctor, and they are very eager to have this option. So whenever you will ask yes or no, they will not define their symptoms. They will shake their head and answer by yes or no. So leading question should be avoided. Next is never ask alternating questions, this or that. Never ask alternating questions. Third is avoid questioning along line of remedy. Suppose you get a patient who is having headache. Whenever she goes out in the sunlight, she is having headache, and the headache comes on and is aggravated at 11 a.m. So you go on asking, have you emaciated from before? Do you feel cold? Are you happy without regular meals? Do you like salt? Do you dream of robbers? So that you can give natramute as the particular remedy. You should avoid doing that. Okay. Next is, while you are dealing with one symptom, confine yourself to that symptom only. Confine yourself to that symptom. So do not skip from one symptom to another. Headache, so take the sensation or diabetes, then only go to backache. Not skipping
वो
from one
आवाज
to
नहीं आ रही थी.
which one? Which could you not hear?
Last point. While you are
While you are dealing with one symptom, confine yourself to that symptom. That means when you are asking about headache, get all the points ready about headache. Location, sensation, concomitant modalities. Then only go to another symptom. Do not shift haphazardly from one symptom to another. Okay. So write all these things, then we will go to the next part.
मैम प्लीज 4th पॉइंट रिपीट कर दीजिए.
क्या समझ में नहीं आया बोलो. What do you understand by this? Why you are taking? What do you mean by that?
आ गया मैम.
हाँ?
मैम हो गया मैम.
समझी नहीं. बोलो.
मैम हो गया. थैंक यू.
हो गया. समझ में आ गया.
यस मैम.
What did you understand? Tell me.
जब सिंगल सिम्टम से मैम डीलिंग करेंगे तो उसके लिए मैं फिर से उसको कंफर्म करना होगा बस.
No. When you are taking a case of particular symptom, suppose headache, first you complete that symptom. The patient, how do patient come to our clinic? First the patient will come, मुझे सर में भी दर्द होता है, कमर में भी दर्द होता है, घुटने में भी दर्द होता है, and you go on writing pain in knee, pain in head, pain in this, pain in that, not like that. First, suppose you take the headache. Then you ask that in what part of head do you have your headache? What exactly is the sensation? It is throbbing type, biting type, or what kind of sensation are you having? What extra symptoms are you having? Do you get blood in the eye, or you have to urinate numerous times when you are having this headache? How do you feel better? Do you get problems from light? Do you get problems from, or are you relieved by sleep? First, you complete that particular point. Then again, you go to the knee pain. Either your knee pain is in more in left side or right side. Which one among them is more? Which knee pain is more? After that, you ask that have you taken any medications or not? Are you better while walking about, or are you better while resting? This kind of symptom. When you are dealing with one particular symptom, first you complete that symptom. Confine yourself to that symptom first. Do not skip. The patient will say randomly this and that and this and that. Ask the patient that wait, let me first complete this headache part, then I will go to the backache part, or then I will go to the knee pain part. Like this you have to deal. Understood?
यस मैम.
Okay. Anyone else having any problem? Okay. Next one, huh? Deflected current, very important. What is deflected current? Any idea from your like 4 years knowledge?
Obstacle to cure.
Obstacles to cure. If it is obstacles to cure, I agree that it is obstacles to cure. Why has Roberts taken such pain of explaining obstacles to cure under such a very difficult? You don't see that the name itself is very difficult. Why has he taken this particular name, deflected current? What is the significance? Oh, I'll tell you. This is in relation to light waves. Okay. When light waves, we all know deflected current is obstacle of cure, but why the obstacle of cure has been named as deflected current, we do not know. When the light waves are traveling in a certain direction, and if they meet some obstacle, get some obstacle, what happens is that they will be deflected, their direction will be turned in some other way. They will be deflected at an angle proportion to the angle of interference. Angle proportionate to the angle of interference. Similarly, when a cure is taking place in certain direction, whenever there are certain obstacles, there are many obstacles. Okay, we will come to that one by one. When it is met with some obstacles, the cure will be deflected, and it will be like to the proportion of what the obstacles are there. If the obstacle is less, that deflection will be less. Cure will somewhat take some more time. But if the obstacles are very severe, then the cure will be totally diverted. Got it? Clear? This point is clear, yes or no? Okay. Then I suppose it is clear. Good. Now I will come to obstacles of cure one by one. This obstacles of cure deflected part is a very favorite topic of examiners, you know. They ask questions from here very, very frequently. So it is better that we will
Ma'am,
just
previous slide, please show answer.
this one.
Yes, ma'am. Okay, ma'am. Done.
Okay. ठीक है. Now name the obstacles of cure. What do you think? What can obstruct a cure? What can obstruct a cure?
Miasmatic cause.
Why are you
If-
at first? Miasm is much later on. Think something normally as a layman. We'll go to miasm later on.
Ma'am, you are not audible.
I'm telling you, we'll go to miasm later on. Give me some easy obstacles.
Obstacles
Currently,
from
I'm not concerned with miasm. Huh?
obstacles with physician side or patient side.
No. What are the obstacles? What might obstruct a cure? One of the obstacle can be pathological condition of patient. Yes or no?
yes, ma'am.
If the patient is incurable, the patient will improve until a certain degree. After that, the patient will not be wholly cured. So that is the first and foremost thing. Don't jump into my assumption. There are a lot of obstacles. You know, if you go to this chapter reflected
मैम
currently,
आपकी
a lot of
आवाज
obstacles.
नहीं आ रही थी.
Okay. Don't worry if even my voice breaks, all the important points will be there in the slide. Okay. Later on, if we have any queries, because I don't know, there might be some network issue. Later on, if we have any queries, we will sort it out. Don't worry. Okay. Next is that there can be any sort of mechanical obstruction. If not non-pathological, there can be any mechanical obstruction. Like presence of a foreign body. A person is having leg pain, you are giving medicine, the patient is not cured, leg pain is not going. Later on, you come to know that the patient is having a titanium plate. He had a fracture some years back. There is a presence of a foreign body. And due to that, the patient is not improving fully. Okay. That is a kind of mechanical obstruction. Ear pain, there is ear pain. A few days back, okay, I heard from one of my acquaintances also. A 9 or 10 years old girl having ear pain. What was the problem? You know, moti jisko batate. I don't know the exact English for that. There are beads, I think. So what that girl did is that she was irritated with her brother, took two of that beads and put it into her ear. So in that case, even if you give medicines, it will not work. So that is a mechanical obstruction to cure. Next is very important, psychic trauma and emotional stress. If you give the patient medicine for sleeplessness and the patient is in high anxiety of losing something, losing a loved one, or some business loss, the patient will not be cured. As simple as that. So, psychic trauma and emotional stress. Hahnemann himself has told that there is nothing so grave, so serious than unhappy domestic conditions. Unhappy domestic conditions, okay? They are the, what to say, they are the most dreaded obstacle. Unhappy domestic condition. Apart from that, as I told, over anxiety, financial stress, tension, all these things are again points. Okay. Fourth one, all sorts of drugging. All sorts of drugging. सेल्फ मेडिकेशन, जब भी हेडेक हो रहा है दुकान में जाके पैरासिटामोल, बेंसारिडोन, all these things the patient is taking. That is another active obstacle to cure. Okay, that is proved to be one of the greatest barriers to cure. This drugging and self-medication, it is one of the greatest barriers to cure. Another is girls will be very certain cosmetics to suppress fascination, body odor, then to make ourselves beautiful, BB cream, CC cream, and whatnot. Okay. So those are another obstacle to cure. Which are taking place from their removal preparation. That is also common with girls. Hair removal preparations. Okay. So he had seen a case of from use of that. Another one, cough. He gave coccus cacti to stop that cough, which was originating from use of lipstick. Then perfumes. Now these things, if I say, obviously you will be upset with me. So I will shift to the next one. Problem of diet. First thing Robert says in the problem of diet, soft drinks. Whenever we are going out in this weather, not feeling like eating anything, we just buy a Coke, a bottle of Coke, and we are happy with that. Then another, we'll have to maintain zero figure. So we totally stop eating nutritious foods. We totally stop eating, leave alone nutritious foods. That is another one. Problem of diet. This is one point. Another thing is that which is faced by low. Obstacle. That is also a problem of diet, but it is somewhat different from that problem. We can classify it as economic obstacle. Why? Because this will lead to malnutrition. Another one is lack of exercise. Hahnemann, when if you go through chronic disease, he has not told that when you are treating a patient of chronic disease to advise him or her complete bed rest. He has told that mild, moderate exercise, open air is the best. So lack of exercise is another. Another one is that whenever the patient focuses on a particular symptom, patient's favorite symptom, the patient has 3 or 4 problems, but the patient emphasizes on a particular symptom. So the rest. So in a nutshell, these are the things. These are from the patient's point of view. Obstacles of cure is not this much. It is. One is the source of the remedy itself. If the remedy is genuine or not, if it is collected in proper manner or not. You have read in pharmacy, na, collection, preparation, how it should be done. Hahnemann has also told that whenever you are giving patient medicines, it should be genuine and pure quality. So source of medicine is a very important point for obstacle of cure. Source of medicine, another is proper labeling of medicine if it is not done. Okay. And the last one, though there are a few more, last one is that when we are prescribing based on keynote. Keynote is a possible obstacle to cure. Important one. We are not focusing on the whole totality. We are just basing the case on keynotes, and we are prescribing on the basis of it. So keynotes can be used as a reference to Metria Medica, but it is not Metria Medica, right? So these things should be kept in mind whenever you are treating a patient. So if you have done, then we will go again to the next part. Done, I think. अच्छा, any problem in this part, obstacle to cure?
मैम 5th पॉइंट एक बार एक्सप्लेन कर दीजिए ना.
कौन सा?
5th पॉइंट कॉस्मेटिक.
Cosmetics, huh? Cosmetics, I was telling that the use of perfume, various this sort of creams, beauty creams, then what else? Lipstick, all these things, these are also obstacle to cure. Roberts have said about two cases. Okay. One was that a patient was using hair removal cream and paralysis resulted from that. Another one, which he has told, is about a case of cough. The cough was not subsiding. He gave coccus cacti. That cough was somehow related to the patient's use of lipstick. That is what I meant by it. So if you go through the chronic disease, okay, Hahnemann has also mentioned all these things, that these perfumes of any sort, cosmetics, these all should be avoided while treating a case of chronic disease. Okay.
Yes.
Anyone else? Accidental symptom. What are accidental symptoms? Acha. Now tell me one simple question in yes or no. Answer in yes or no. A patient comes to your clinic. He or she gives around 15 symptoms. Some are serious, some are vague. You feel that the patient is exaggerating some things which are not related, which is not logical. One among these is the patient, whenever the patient discusses complaints of this flatulence and all, the patient will say that this flatulence, it goes up in my head, okay, and it produces different head symptoms. So will all the symptoms totally be unprotected symptoms, or you have to sort it out to make a proper totality? Does totality means all the symptoms, or does totality mean that you have to sift among them and get another?
Totality does not mean the aggregation of all the symptoms.
Okay. Then what is it?
मैम आपका आवाज ही नहीं आ रहा है.
आवाज नहीं आ रहा है?
बीच बीच में चला जा रहा है.
Totality is, अच्छा, totality is not only the numerical totality. Okay. Accidental symptoms, we mean that whenever you are taking, say, 14 symptoms, some among them will not be logically related to the case. So symptoms which are not logically related to the case, they do not fall under the totality. Symptoms not logically related to the case. These are the accidental symptoms. They cannot be allowed to influence the choice of remedy. Okay. Acha, angel child. Just remember that angel child is a phrase. It is an English term. It's a phrase for an unborn baby who has been lost due to stillbirth, miscarriage, or something. Silesia baby has so many problems. Roberts has told Silesia baby as classic problem angel child, Silesia child. Silesia child as classic problem angel child. Just remember this. No? Then we'll be done with the Roberts part. You go to the square close part.
एंजल चाइल्ड माने स्टील बर्थ चाइल्ड.
Not only
Stillborn
stillbirth,
baby.
whenever a baby has been lost before birth, that is an angel child. Actually, it is a term of remembrance. Okay, to grieve when the parents are grieving, to console them, it is told that it is an angel child lost due to some reason, either due to miscarriage or stillbirth or something else. When the unborn baby has died, parents are grieving. That is why at that time, to console the parents, the child is referred to as angel child. Okay, done. Done, yes or no?
Yes, ma'am.
Yes.
Toward close. First, important, this one is very important, schools of philosophy. Just remember that he has told about 3 schools of philosophy. Can you name any of them? Can you name it? One is materialistic. Bolo.
Vitalism, substantialism, and idealism.
Materialistic, idealism, and substantialism. What is materialistic? Materialism? Those are all the material cause of diseases. Okay. Idealism is realization of a system of ideas. Anyone belong to which school? This is asked. Anyone was a? Whenever you get this question, pick on vitalist. Anyone was a vitalist? Susceptibility, we have learned some part of it in Roberts. Here, Stuart Close has told that susceptibility can be deficient and can be excessive.
Ma'am, substantialism.
Substantialism, idealism, and materialism. Just note the names.
मैम सब्सटेंशियलिज्म वाइटलिज्म है क्या?
It is idealism plus materialism is substantialism. Combining these two is substantialism.
Okay.
Okay. Come to this thing, susceptibility. What happens when the person is having excessive susceptibility?
Idiosyncrasy patients.
Patient will suffer from aggravation. There is a general hypersensitiveness. Okay, general hypersensitiveness. So deficient reaction. What will happen? Just the opposite. Here, important point is that in deficient reaction, classic example of this difference in susceptibility, you will have heard many people around you. They are very proud to say that I have never for once fell ill since my childhood up till now. I have never fallen ill. Now I had fever, now I had cough, now sardi kasi, nothing. Once, like suddenly one fine morning, you will hear that the patient is suffering from cancer. So their body is not reacting properly. Reacting, how should they react? That is the case of deficient susceptibility. And in case of excessive, I told the patient will suffer like anything, just the opposite. There will be change of weather, the patient will suffer. There will be anything else, any mental stress or something, the patient will suffer. It is like that. slightest error in the diet, the patient will suffer. It is like, okay. Acha. Deficient reduction, what I was telling, important point is that in treatment of chronic disease, when improvement ceases, and well selected remedies do not seem to act, what will you do? Well selected remedies do not seem to act, what will you do? In this particular case, yes, what will you do? What will you give the patient? Tell me, tell something.
वेल सिलेक्टेड रेमेडी अगर काम नहीं कर रहा है तो
हाँ,
इंटरकरेंट रेमेडी देना चाहिए.
very good. How many dose?
सिंगल डोज.
Single dose of intercurrent remedy. Very good. So in this case, you will give a single dose of intercurrent remedy. This is asked as question. Let's write this. We'll go to the next one. In case of deficient this susceptibility, Bonninghausen has gave a certain list of remedies. Okay. If you want, you can write carbovage, Lodocersus, moistures, opium, sulfur, then the different nosodes, and thuja. Okay. And in case of excessive susceptibility, medicines he has suggested. These are all, remember, suggested by Bonninghausen. These medicines, not by Hahnemann. Okay. Here he has told to use asarum, then chamomilla, coffea. This also I have seen questions from this chart somewhere. China, though it is difficult to remember, I agree. Ignatia, Nagsvo, Pulsatilla, Teucrium. Teucrium is a medicine which is suitable when too much medicine has been taken. This you will find in your Metria book. Teucrium is a medicine when too much medicine has been given. Teucrium, madam. Okay. So write this, then we'll go to the next part. Write and tell me. Done. Done. Yes or no?
Yes.
If you write in this speed, we will not be able to complete the syllabus. I'm telling you. Be fast. Disease classification. How Stuart Close has classified diseases, how Roberts has classified diseases, it is different. When we will do the miasms, we'll discuss it. Here, he has given 3 classifications. One is drug and occupational disease. First one is drug and occupational disease. Okay. Then is infectious venereal disease. What are those? Infectious venereal disease. What happened?
Gonorrhea.
Infectious venereal disease. Now you come to miasms. Syphilis, psychosis. We are dealing with disease classification. Gonorrhea is not under this. And all other natural chronic disease, obviously, which arises from soda. Okay. Now, in this context, another important thing that you will get is doctrine of latency. Can anyone guess what it is? Though it is a very simple thing, but still, you have to know it. Doctrine of latency. What does this resemble? Latency, it is related to which term? It is about all the chronic diseases. Unless and until they are awakened, they will remain in their latent state. That is the doctrine of latency. It was told by Stuart Close. This is very important, but it is very easy. So, soda, syphilis, and psychosis. They remain latent for long periods. Until circumstances awaken them. Okay, this is the doctrine of latency. Okay. Now, soda and tuberculosis. Remember that all the tubercular lung and chest disease arise from soda. Okay. In this context, it is said that cause is identical and that the two terms are synonymous. This is very important again. Two terms, soda and tuberculosis, these are synonymous. Sabourard, he told, leprosy is a tubercular disease which is closely allied to tuberculosis. Very important. Leprosy is a tubercular disease closely allied to tuberculosis. And Osler, he has told tuberculosis is the most universal scourge of human race. These are just quotations, make up. This is important. This is important. Scourge of human race. Okay, write this. We'll go to the antidotes and idiosyncrasy one. Write this and tell me. So any question till now? Be fast, be fast.
Done.
Here just we will discuss very briefly. Just know the names of antidotes Stuart Close has told. We will not go into the details. One is the physiological and dynamical or dynamical. Second is chemical antidote. And third is mechanical antidote. Just know the names. Nothing else is required. Idiosyncrasy. 2 or 3 points are there which are very important. Idiosyncrasy can be inherited and can be acquired. Generally, it is related to sodic constitution. This is very important. This comes. So it is a trait of sodic constitution. Okay. Cause of idiosyncrasy to some particular drug generally is previous abuse of that particular drug. This is very important. I am allergic to Montelukast. That means maybe I had abused that particular drug. Particular drug. Okay. Done.
Done.
A cure is always a result of art and is never brought about by nature. This is told by Stuart Close. Why is this line important? Because he has told that there is a certain difference between cure and recovery. Cure and recovery. Cure cannot be brought on by nature, but recovery, whenever the person spontaneously returns to health, spontaneous return of health, that is recovery. Cure is not possible only by nature and not by medicines, but recovery is. So spontaneous return of health, that is the recovery, while cure is not. Okay. There are certain requirements of cure. One is that you need a general principle of medication and you have to apply that principle. Homeopathy is following some principle. Antipathy is following some principle. Allopathy is following no principle. So that is first thing is that direct application of a definite general principle of therapeutic medication.
Ma'am, recovery cannot done by only nature and only recovery can only done by mechanical means or medicine.
No. Recovery can be done by nature. It is spontaneous. Becoming healthy. Being sick. Thanda laga tha, you did not take any medicine, and after 7 days you are cured. That is recovery. You have recovered. Cure is only brought on by medicines. Okay. Acha, first is that application of a definite general principle. Then it must be individual, not 5 or 4 medicines at a time. And the last one is complete collection of records, record maintaining. Collection and record of the facts. It constitute the natural medical history of individual. Okay. Done.
Yes, ma'am.
So you should tell now after you are done. What is the second remedy? Very important.
Placebo.
Placebo. Second best remedy. This was told by Stuart Close. Remember this. This comes as question. It comes from a Latin word. What is the Latin word? You have read pharmacy now. What happened to you all? Placere. What does it mean? Placere?
To please.
I shall please. Acha, symptomatology. I will just ask you one thing that I give you a group of subjective symptoms. I give you a group of objective symptoms. Which, according to you, should have the highest rank? Which should be like based on top? The subjective or the objective?
Subjective.
Objective. Tell something only like I had seen a video.
I can't hear.
हाँ?
मैम आवाज ठीक से क्लियर नहीं आ रहा है, लास्ट में सुन नहीं पाया.
अच्छा. Subjective symptoms, you will give the highest rank or objective symptoms? Don't tell just objective so that I can't hear the rest of it. Tell something, subjective or objective?
Subjective symptom, subjective.
Subjective.
Objective.
No. Subjective symptoms, which are patient himself or herself, that is having the highest rank. The subjective symptoms are having
Ma'am, can't understand you.
which one do
Your
you
voice is not audible.
Actually, I'll tell you once more. I will repeat, don't worry. Voice is clear now?
Yes, ma'am.
Now, if I give you a group of subjective symptoms and objective symptoms, subjective symptoms are those which the patient or the subject himself states. Okay, those are the subjective symptoms. Objective symptoms means which we can see, which the patient cannot describe, which we are seeing, that is the, like pain. Pain is a subjective symptom. Fine. But if there is a swelling, that is an objective symptom. Fine. So I was asking that subjective symptoms will have the higher priority or the objective symptoms. Here, Stuart Close has said that subjective symptoms, the symptoms which the subject or the patient himself states, that is having the highest rank or that should be placed on top. Understood? Gunjan, I think. Gunjan, understood?
Yes, ma'am.
Okay. Here, he has told a particular quote. He has told that Materia Medica of Hahnemann is a monument. Just write this. Is an endearing monument to the genius of its author. Okay. Achha, true and only basis. Who told this? Totality of symptoms is the true and only basis. This was told by Stuart Close. True and only basis for every homeopathic prescription. Okay. As I write it, then we'll put the next part.
Okay, ma'am.
Okay. Achha. Here I will share a quote by Dr. William Borick. William Borick, he told that the modalities of a drug are pathognomonic symptoms of the Materia Medica. Okay. Now, totality, you can divide totality into two types. One can be the diagnostic totality, the totality of symptoms, which will help you in particular diagnosis of a disease, and another is the therapeutic totality, which will help you in prescription. One is diagnostic, another one is therapeutic. Okay. Achha, what is genius of remedy? What do you mean by genius of remedy? Any idea? This is very important.
Genuine medicine.
Uh-huh.
Genuine medicine.
No. This is the essential principle which gives the individuality. Like individual characteristics of a particular remedy, that is the genius of remedy. Got it? Do not get confused with drug proving. There is something similar over there. Genius of medicine or something is there, I think. Which gives it its individuality. So that burning thirst and that fear of death, fear of crowd of aconite, these are the genius of remedy of that particular medicine. Got it? Okay. Here, Stuart Close has told another important thing. You all know about day books, right? Day books. You have not heard of day book.
ये
Now, what is the day book?
मैम जहाँ पर हर दिन मतलब जिसको ड्रग प्रूविंग करवाया जाता है वो उसका ये लिख मतलब जो उसके ऊपर सिम्टम आता है वो लिखता है वो।
हाँ. They are writing the symptoms, but that is not the materia medica. Okay. If you in future, if you do any one of you, if you do this PG in pharmacy, you will see that there is a proper protocol for drug proving. Okay. After this day book is constituted, after the proofers, we cannot say patient, proofers, write down the symptoms and all, they are analyzed, they are shifted, they are converted into rubric language. So a lot of processing goes on after the symptoms are written. So these day books are not the materia medica. That is what Stuart Close said. Day books of the proofers are not the materia medica. There will be a logical arrangement, there will be shifting, there will be theming according to particular themes. Okay, so day book of proofers are not materia medica. That is what Stuart Close told. Got it?
मैम जीनियस ऑफ रेमेडी का जो आप बोले वो भी क्या मतलब स्टुअर्ट क्लॉस ने बोला था?
Whatever you are studying right now, everything is written there in Stuart Close. I will show you. Just a second. See the title. Okay. Each and everything is from Stuart Close. Before that, I had discussed Roberts. Before that, I had discussed Kent. It is like that. Okay. Keynote prescribing. Who has introduced this keynote prescribing? Many a times we have discussed in repertory class. What was the name of that person?
H.A. Roberts.
H.A. Roberts. Were you there in this repertory class?
G.
G.
कौन से?
You are not going through any of the notes. You are just collecting them and keeping them.
H.N. Guernsey.
Guernsey. H.N. Guernsey. बुक देख के बताया ना देख के? बोलो.
हम देख कर बताया था.
Good. I knew it. That is why I asked. Okay. Keynote prescribing. I will deal with you people later on. First, I'll have to complete this. Keynote prescribing, is it based on characteristics or not? Just answer yes or no. This came in last year UPSC. Keynote prescribing, remember that it is strictly Hahnemannian and it is based on characteristic symptoms. Remember this. It is not deflecting from Hahnemannian principle. It is based on characteristic symptom. This was asked whether it was based on characteristic symptoms or not. Are you going through the previous year papers? Hmm? No one. Not a single one. Have you written this down? Then we'll go to the next slide.
तुम लास्ट लाइन रिपीट करिए ना
कौन सा वाला बोलो?
मैम की नोट प्रिस्क्राइबिंग वाज
क्या
रिटन
समझ में
वेल
नहीं आया? Keynote
मैम
prescribing.
हाँ
Strictly it is based on Hahnemannian principle. Okay? It is based on characteristic symptoms only. Though keynote prescribing, it may seem that randomly on selecting any kind of symptoms. It is not that. Keynote, whenever we do prescription based on keynote, we will select characteristic symptoms only as keynote. Keynotes are characteristic symptoms. That is what I know. Okay.
तो मैम इसको मतलब हैनीमैन स्ट्रिक्टली हैनीमैन सर ने फॉलो किया था ये बोलना
No. नहीं. It is based on Hahnemann's principle. It is that is why it is strictly
ओके
Hahnemann ने
Okay.
follow नहीं किया था.
ओके मैम ओके
Based on Hahnemannian principle of selecting these characteristic symptoms and all. Got it?
ओके मैम
Okay, I'm going to the next slide. Acha, what are characteristic symptoms? We have talked so much about characteristic symptoms. What are characteristics? Organon का problem क्या है? It seems that it is very easy, but when you sit to answer the questions, उससे ज़्यादा टास्क कुछ नहीं लगेगा. You apply your common sense and you get the answer wrong. So what are characteristics symptoms? Tell me. If you don't answer this, na, I will be really very angry.
The symptoms are peculiar symptoms. Peculiar, unusual, rare symptoms.
After discussing all these things, why is ma'am asking what is characteristic symptoms? सब तो बच्चे थोड़े ही हैं. First year में ये तो पता चलेगा हम लोगों को. The reason I am asking this is because Adolf Lippe gave a particular definition or a particular calculation regarding this. He told that you take the totality of symptoms. From that, you subtract the symptoms of the disease. Whatever you are getting, whatever is remaining after you subtract the symptoms of this disease, that are the characteristic symptoms. This was told by Adolf Lippe. Okay. There should be at least 3 characteristic symptoms to base on it. At least 3 characteristic symptoms. This was actually told by Dr. Herring. Herring has translated only the third edition of Organon of Medicine. Only the third edition. He has told that every stool must have at least 3 legs if it is to stand. Every stool must have at least 3 legs. If it is to stand alone. He meant that at least 3 characteristic symptoms should be there to make a prescription. Okay, last point from this thing, philosophy part. Philosophy will be completed. Negative general symptom. What is negative general symptom? This came in 2019 reality. I can remember which questions came there, and you are not even bothering to solve the questions. This is pathetic. What are negative general symptoms? Any idea? What do you mean by it? Just look into the words. Negative general space is the general symptom. What is meant by the negative general? Anyone? You can try at least.
Ma'am, absence of certain striking features.
अच्छा, मतलब
मतलब कोई डिजीज में फीवर के साथ अगर ये रहना चाहिए, थर्स्ट रहना चाहिए, वो अगर नहीं प्रेजेंट रहता है तो वैसा सिम्टम.
So whenever there the disease in a disease, the symptom that should be present, that is absent, that is a negative. Absence of certain striking or customary feature of a disease. Examples are fever without thirst. This only came. The symptom was given and you were supposed to pick the correct kind of symptoms. Fever without thirst is which kind of symptom? Accidental symptom, negative general symptom. It was given like that. Then coldness with aversion to being covered. And hunger without appetite. These are the kind of negative general symptoms. Okay.
Okay.
हाँ, बोलो. This is the last
Okay.
one. Philosophy is completed. If you read these parts from your philosophy, apart from your which have been done last day, 12 observations and second prescription, then this is enough. Next day we will take up Robert's view of miasms. Not only reading symptoms will help. Nowadays the patterns of this question are changing. So we need to delve deeper. So now tell me if you have any queries from today's class. There is any problem, any thing you could not write in this?
मैम क्लास के बारे में कुछ क्वेश्चन नहीं है, पर कुछ क्वेश्चन ऐसे है कि जो अभी जितना भी मैंने मतलब अभी तक लिखा है अभी तक, तो उतना ही क्या पढ़ना है, या फिर फिलोसॉफी के बारे में हो, या फिर कुछ बाहर से भी पढ़ना है? नॉट ओनली फिलोसॉफी, ऑर्गेनन में भी क्या पढ़ना है, कैसे पढ़ना है? और
Organon में it is applicable for all subjects. First and foremost thing I tell in every class that you have to get hold of previous year question papers. Are you new to this class? Is this your first class with me?
यस मैम.
Then you have, I think you have missed it. Have you got previous classes? Recording or something have you taken? Or this is the first one?
Ma'am, I got the previous class lectures, but I just started watching some of them.
Have you gone through them?
I can't hear you, ma'am.
No. Have you gone through those classes? Those recordings?
Yes, ma'am. I gone through one of them, I gone through one of them.
Okay. What I tell, in the first class only I have told this, that you should get hold of the question papers, be it state PSCs, be it your AIPGT, be it previously NIH used to conduct separate exams. Okay. UPSC, whatever papers you are getting, be thorough through all of them. Why? Because once an uncommon question comes in some year PSC, be sure that it will get repeated somewhere. I have covered the maximum while teaching also. See, this is question mark. It's means that some question. Okay. So if you go through them, you will understand that what to study and what to leave. Okay. Now, Organon, what things you need to study? Introduction, preface, and Hahnemann's biography questions come from there. Aphorisms, so not all the aphorisms. There are certain, when we will go to the aphorisms, I will tell you. There are certain aphorisms which need to be studied. Achha, ye ho gaya. Or philosophy, I have told. Philosophy, generally, you will not get. Your luck is too bad, you may get some random line. Generally, it does not. Okay, but each and every year, questions come from there. Okay. Another is miasms. Miasms nowadays, they are not only limited to
मैम लास्ट में आपका आवाज चला गया था कुछ लास्ट में आपका आवाज चला गया था कहाँ से क्वेश्चन आता है मतलब वही पोर्शन सुनाई नहीं दिया
अच्छा one is that introduction. Okay, I'll write it, no problem. One is introduction. Introduction means Organon's introduction. Whatever generally comes, I have discussed it in class. Then is preface. Preface से बहुत कम आता है, फिर भी who translated this, who wrote this in which year, whatever, these things come. Then you will get aphorisms. Aphorisms, so you know, not all are important, but there are certain topics, intermittent fever, from the later part of Organon. So when we will go to the aphorisms we'll deal last. Aphorisms is another point. Then is chronic disease. Chronic disease I will be taking hopefully in the next class. Miasms. Apart from chronic disease, miasms are different. Miasms as from H. Roberts' point of view, miasms come. Okay. They will give separate questions as well as separate, what to say, in between lines questions are also there. Then biography of Hahnemann. This we had already discussed. I think these are sufficient for Organon. These are sufficient. But point is that you go through the question papers, because once anything comes in questions, it has a chance to repeat itself. So best is go through the question papers and see if there are any extra topics. If you go through it now, then if you tell me, I will discuss it in class only. But once the class, my course is completed, it will be difficult for you also. Now, if you go through the question, ki ma'am, this part I have seen question, this part has not been covered, so please discuss it. We will discuss it, no problem. But as far as I have seen, I have thoroughly gone through the question papers, and whatever study materials, whatever notes I am providing in the class, it is based on those previous questions only. Okay. Well, anything else?
ओके मैम मतलब जो क्लास में हो रहा है वो और प्रीवियस ईयर क्वेश्चन पेपर यही दो चीज करने हैं
हाँ ये काफी
ठीक है मैम कोई एक्स्ट्रा कोई बुक पढ़ना होगा कि मतलब जैसे जो ऑर्गेनन ऑफ मेडिसिन उधर से भी कुछ पढ़ना होगा या फिर और एक्स्ट्रा कोई बुक पढ़ना होगा कोई है कुछ ऐसा कुछ
है
नहीं
तो
नहीं पढ़ना नहीं मतलब जो अगर मतलब एग्जाम के लिए कुछ बुक पढ़ना है अलग से या फिर मतलब नहीं तो बहुत सारा हो जा रहा है वरना इतना सारा तो टॉपिक
हाँ बहुत सारा होगा तो see philosophy whatever you are getting, it is not that I have consulted some one particular book. It is all are authentic sources. Okay, so if you want to study Organon, you will never be able to complete it, let alone revision. It is not possible technically. Richard Hell का book है based on biography of Hahnemann. Then philosophy 3 books are there. क्या छोड़ के क्या पढ़ोगे? तो basic what you have to do is you don't have to like read everything, all the chronic disease, all the volumes. It is not like that. Have a concise idea kahan se question aa raha hai. Your study for AIPGT, not only Organon, but for all the subjects should be question oriented. Question ka na kuch specific topics are there. As I told, these are the topics from Organon. इसके बाहर में नहीं आएगा इसको छोड़ के. So they will make questions from this particular topics only. Just see that if there are any extra remaining things from there or not. Okay.
Okay.
Achha, anything else? If you have any problem, feel free to connect. No problem. I'm always there to sort your queries. Okay. Thank you. Thank you all.
Thank you, ma'am.
Thank you.